Alright class, today we'll be covering the 6 types of skeletal joints based on the shape and movement. These joints are what keep our skeletons in motion. First, the plane or gliding joints, flat surfaces that slide past each other. Think wrist and ankle bones, small movements but important for flexibility.
They could just kinda slide by each other.
Oh, so that's how I can wave my hand and tilt my hand.
Man, so that's the way the human joint.
Exactly. Second, the hinge joints, like a door. They move in one direction, flexion and extension. Examples, the elbow and the knee. Third, pivot joints. They allow rotation. The neck between C1 and C2 and the forearm, radius, and ulna use this joint. Fourth, condyle joints, movement in both directions, like bending side to side, found in the wrist. Finally, ball and socket joints, the most mobile type. The shoulder and hip help you move in nearly every direction.
That's why I can swing my arm, but not my knee.
That's correct. Exactly. Mobility versus stability. Now I need the athletes to really pay attention. Most hurt their joints while playing their sport.
Man, I don't need to know this. I'm a pro. Nothing will happen to me.
Right. We'll see about that.
A few moments later.
Man, I don't need this. I'm practically like NFL bound.
Man, NFL is not fooling you.
You're so funny. I bet you if you throw that ball, I can definitely catch you.
Really? Wish I call it ESPN now.
The ball,
First round pick.
Ty, you throw that ball like you were aiming for the moon.
I thought your ego was real big to catch. Hey, my bad. I thought your ego could reach you.
My shoulder feels like it's in 3 pieces.
Well, maybe that will match your brain cell.
I think I twisted.
Why is the emergency this time?
Well, Sam here thought he was an NFL player, but his body was so weak. Wow!
Coach, I think I need medical attention.
Just go to the nurse and say there is another NFL injury.
Okay.
Yeah, and while you're at it, make sure you tell her to put some ice in her eagle.
Before we finish the skit, let's hear from Dr. Sana, Jocelyn, and Tamara about the joints.
So in this section, we're going to be talking about joint pain and bruises. And an example of joint pain is inflammation, which is caused by brutistis. And what that is when you are running into someone and you hit them on their knee, which causes an injury. This is due to inflammation or synovial membrane. Another joint pain is called sprains, which is swollen or like pain that like occurs to like a part of your leg, and this takes place in your ligaments or tendons. And when that happens, that just means that they'll be torn away from the bone. Another part of this section, like I said, is diseases, and our first disease that we're going to be talking about is called arthritis, which is a widespread, and that disease is the most crippling disease in the United States. So basically, arthritis comes in different forms, but mostly has the same symptoms, which is pain, stiffness, and swelling in the joints. Common forms of arthritis is osteoarthritis, rheumatoid arthritis, and gouty arthritis. Osteoarthritis is a common form of arthritis that is a chronic disease that affects the aged.
Okay, in this section, we will look at a closer look of anatomy, which involves exploring the structures of the human body, adipose, mitosis, and group. Davis had to understand how form and function are closely connected. Breast anatomy focuses on the large structure visible to the naked eye, such as organs, muscles, and bones. With microscopic anatomy examines smaller components such as cells and tissues, which require microscope for observations the story of circuitry, cells, and hydrology.
Okay, so in this section, we're going to be talking about joints and its functions. So skeletal muscles are responsible for the voluntary movement of bone, as you can see, which are the B and G slender fibers arranged in parallel bundles that give our arms, legs, torsos, neck, and face much of their shape. The muscle of mastication move the lower jaw primarily for chewing, but they are also necessary for speaking.
Why are you here again? This is the second time this week.
Nerves, my shoulder. I felt
Again, I thought you were indestructible.
Bro, just help me.
Okay, only because I don't want to lose my job. Ooh. Ooh. So, based off my observations, you had a shoulder joint injury. It was probably caused trauma during your game. For treatment, you can use painkillers and also the rice method.
What's the rice method?
Rest, ice, compression, and elevation. You might experience some pain, swelling, and bruising. And unfortunately, you will have to not play your sport for 2 to 8 weeks.
They need me. I'm a pro.
Well, sorry, should have been more careful. See, this is why you should pay attention in my class. Sorry, but should have been more careful. See, this is why you should pay attention in my class.
My arm. My arm.
I guess your team will have their support, huh?
Ow!
Oh, sorry.
Ow!
Oh, sorry, that's your issue.
Bro, you hit my shoulder.
Sorry. Oh, here's some ice. It can help you. Remember, rise. Here you go. Have a good day. Remember, 2 to 8 weeks. Don't touch that football. If I hit you, yeah. Bye. Oh boy, though, this is jeez. Oof. I guess the football team will actually win a game.